Alright, day 26. Today we're talking about strength training, okay? So I want to explain just a couple of like basic concepts, things like reps, sets, rest, volume, all these different things, okay? So reps is the number of repetitions of the particular exercise that you are doing in a particular set. So if you're doing 10 bicep curls for 3 sets, that's 10 repetitions for 3 sets. So you're doing 3 sets of 10 repetitions. Okay, I guess I'm repeating myself. Weight, that's quite, again, self-explanatory. If you're doing body weight, then it's just body weight. If you're lifting weights, then, you'll be able to record down the amount of weights that you are lifting for that particular exercise. Why your workouts are similar? Okay, so I think that this is another important question to answer. It's not about muscle confusion and all those things, but firstly, as you are starting out, you're going to realize that a lot of the movements that you are going to be working on are going to be relatively similar movements, and it's going to be similar across your training career. So things like squats, things like deadlifts. So basically squats are, knee dominant movements. Deadlifts are your hip dominant movements. You have upper body push and pull exercises. You have a core element. Those are, usually what round up a good training program. And then you can include things like unilateral movements and bilateral movements, okay? So basically single leg, single arm exercises or ones that use both. Okay, I'm not going to go into programming, don't need to confuse you with all of these things, but I want you to understand that those are what's going to make up the bulk of your program. And the reason that it's important that there is repetition, right? Your training program should at least last between 4 to 8 weeks of you doing the same thing, and not just doing the same thing, but the same exercise, but trying to progress with load, so with the weight, or even with repetitions, okay? So it shouldn't feel the same week on week. You should be continuing to challenge yourself every single time you step into the gym, which is why it's important that you record down your weights. Like, your muscle only knows tension. So the more tension that you're going to apply to it, the more it's going to basically grow, right? And this is important because progressive overload, again, is something that, you will learn as we get into the program. But you need to make sure you are constantly challenging yourself in the gym. So that brings me to the topic of intensity. Because a lot of times, like in the gym, you maybe can be training, and there are people that, train 4 or 5 times a week and don't see any results. The reason is, 1, maybe they're not following a structured training program. 2, they're not pushing sufficient intensity. Maybe they're taking like a lightweight, like a 5 kg, when they are pretty strong, they're taking a 5 kg and they're just doing like shoulder presses. But, they can do that for like 50 reps and not be tired, right? But they're only stopping at 12, right? So the idea of intensity is, basically how close you are to failure, right? And failure means technical, complete muscular failure. You can't push another rep even if you wanted to, right? You're just going to drop the weight. That's real failure. Honestly, most people have not experienced failure before. So sometimes asking them to push to failure is useful, especially on movements that are, a little less harmful. So things like isolated band works, isolation movements are usually a good bet. But again, really what I want you to really know is that, your workouts are going to be similar, and that's the purpose of strength training because, firstly, it takes time for you to get familiar with the movement. That's one. Secondly, like neuromuscular adaptations, which is, you gaining strength just from getting better at the movements is going to happen. But that doesn't necessarily mean you actually are stronger. It just means you're getting better at the movement. After you're proficient at the movement, then you can begin to add load. Then that actually is a test of your strength. Okay. So again, what we want to build is strength and hypertrophy when we are training. And it's important that you are, pushing yourself and doing similar exercises in the gym for that effect. Okay. So how do you know if you should increase your weight and what weight should you use? The truth is that I can't give you those numbers, right? What I would suggest is that firstly, if there's a training log, right, and there should be one, you should be using that. Okay, the next thing is your training videos, your form videos. Those are very, very important. Make sure that you are sending them to me on specific movements that you have questions on, or on specific movements when you're not sure about intensity, all those different things. Send them to me. If you're not sure at all like in any way a little bit, like just send them over to me. It's better to, to clear that up than to, guess and wonder whether or not, that movement needs, any changes. And if you're doing it well, then all the more, like, that's great, right? So that's that. And, I want to explain a little bit, like I kind of spoke about intensity. I want to explain the concept of that and how we measure that, right? So RIR and RPE is kind of how we measure that. Honestly, it is relatively an advanced way to measure intensity. As a beginner starting out the first 6 months, you can easily increase load across sessions, right? No problem. You should be increasing load across sessions if you are maintaining form well, okay? As you start to get more advanced, things like concepts like RPE and RIR come in. So RPE is your rate of perceived exertion and RIR is your reps in reserve. So they are sort of opposed to one another, meaning that 9 RPE would be a 1 RIR, 8 RPE would be a 2 RIR. So what I mean by that is 8 on the scale of 1 to 10 would leave 2 reps in reserve, right? Okay, so say you have a goblet squat and you're doing that with 30 kg for 12 reps, and I ask you to go to failure and you manage to hit 15 reps. So that's if you stopped at 12, that's 3 reps in reserve, right? Basically, this is a way to sort of play around with intensity and make sure that you're always within the 3 to 5 range of reps in reserve. Usually 1 to 3 is where we want to sit. Okay, so that just makes sure that we are pushing intensity enough and we're not leaving too much on the table in terms of gains. Okay, so hopefully that explains. I spoke a little bit about technique, so make sure you are sending over your form videos to me. And the last thing I want to talk about is this idea of pain and soreness. When it comes to pain and soreness, right, and I mean even injury, there's a lot that can be said here, right? At the end of the day, I'm not a physical therapist, right? Just a personal trainer and coach, right? So if you are really experiencing, pain and you think it's pain, then just stop your training and, make sure you visit like a doctor or a PT or all those specific things, right? But I think more often than not, right, what we think is pain is actually just pure soreness. And it's very important for us to be able to differentiate between soreness, pain, even different types of pain. So acute pain, chronic pain, and what's actually causing that pain if you're able to pinpoint what particular exercise caused that. So just keep in mind that some soreness is definitely a part and parcel of training. Okay, you're going to be sore likely 2 to 3 days after your training. That's called DOMS, delayed onset muscle soreness, right? You're going to be sore if you train your upper body on Monday. You're likely going to be sore on Tuesday, Wednesday, upper body. That's why we switch things up and move over to a lower body split if you're training more than 4 times a week, right? But not to complicate things, again, I just want to say soreness is a big part of training. It's totally fine. Again, there are ways that we can work to improve this, right? Stretching, just like going out for more walks, getting yourself into a parasympathetic state, improving your sleep, right, is 100% going to help. Getting more protein in, very important as well for soreness, and just for recovery. So just a couple of things to take note of. And the last thing I want to say is injury. Again, if you are, experiencing specific injury, I think it's important that, firstly, again, you're visiting a doctor or PT, but beyond that, realize that, when it comes to training, maybe for whatever reason, even if we do our best to avoid injury, like these things sometimes happen, and injury is not a reason for you to stop training altogether. I think that this is important. I want to say it. So for example, if you injured your right quad, the rest of your body is still fully functioning, right? You still can train your left side of the body, you still can train your upper body, you still can train everything else. It is not a reason to stop training at all. And honestly, if you stop training, you're going to put yourself at a disadvantage, and it could lead to like greater atrophy or loss of muscle. So it's really, really not what I want. You really need to focus on finding a way forward. And again, that growth mindset approach of, viewing things as, a challenge and opportunity for you to, embrace whatever state that you're in and still find a way forward is going to be very, very important here. Okay. When it comes to injury, and even pain, a lot of it is in your head, right? This like what you think about and how you view pain really, influences what you actually experience physically. So there's a lot more than just what's happening physically when it comes to these things, okay? The last thing that I want to say here is on NEAT and cardio, but I'll talk about NEAT specifically. NEAT is your non-exercise activity thermogenesis, so basically your steps. This is, honestly, the best way to keep your energy flux high, right? Essentially, you are keeping the amount of energy that you're expending very high. People tend to have sedentary lifestyles, they work at desk and everything the whole day. If we can keep our step counts high, we can, keep our calorie intake also relatively equal to that amount, right? Without having to drop it to a level to see maybe a significant amount of fat loss. So it's really important that we are, keeping step counts high, right? And also know that, walking is a very low intensity exercise, and it's something that honestly is good for you. It's like stress relieving, right? So it's beneficial in like every potential way that I can think of. So NEAT is very important, okay? Whether or not you have any cardio prescribed to you is going to be dependent on the individual, so nothing worth going into at this point in time. But there could be cardio prescriptions for you specifically, okay? So just take note of that. Alright, so that rounds up this sort of quick video that I wanted to do, going through a couple of like quick questions on training and what you need to take note of